Welcome back. It's a beautiful morning the day after Christmas. Folks, I want to talk about competition in healthcare. I believe we have stifled the competition. The reason why doctors became doctors, they want to be the best among the best. We have taken away the spirit of all these healthcare professionals. For example, my son, who is a cardiologist, once he graduated from medical school, he wanted to join fellow physicians because there's no way he could survive as an individual. But that competitive spirit was taken away from these young healthcare professionals. I remember the days when I graduated, I always wanted to be the best among the best. I wanted to prove myself I'm the best surgeon. I wanted to prove myself I could be the best doctor. But I don't know what happened to this healthcare man. I just don't like it. I just don't like it. No matter what anybody says, what we did to the healthcare is a medical malpractice. 1990s, the intent was to lower the costs of the healthcare. That was the reason why they came with a brilliant idea, this so-called middleman came with a brilliant idea of forming groups and to lower the cost for the insurance companies. Yes, not for the consumers, for the insurance companies. This is what the beauty was. They wanted to get the contracts from the insurance companies at lower price. But they didn't realize what insurance companies did was they took over themselves, and they basically, for their own reason, they exploited these medical groups and gave the contracts one to the other, and basically they made a mess of this medical group formation. Primary cares started to join medical groups, and specialists started to form groups, and that stifled the competition. The entire spirit of you being a doctor, you want to be the best. Those days are gone, man. Healthcare professionals, they're not looking at they want to be the best. They're looking for a survival. What is the best? How much vacation can I get? How much time I can take off, and how often I'm on calls. This is the number one priority, folks. When I started my medical practice in 1980s, that was not the purpose of being a healthcare professional. I wanted to prove that I'm the best. And I did practice urology for over 35 years. Solo, competed, basically, even though 1990s, even when we formed the medical group, I was the only urologist in the group. I was doing everything, and I did more complicated surgeries, got into trouble sometimes, but I loved being a surgeon, taking challenges. Those days are gone. Nowadays, these medical students, once they graduate, they want to be in a group setting. They want to have a 6 weeks vacation, travel around the world. Oh man. Their priorities are all mixed up. And now you have taken away the spirit of competition among healthcare professionals. That's the biggest blunder we have ever made. I'm not kidding. We have taken away the spirit of healthcare professionals They have taken a Hippocratic oath to be doctors and they want to be the best. Those days are gone, man. I would love to see those days come back. We need to bring the competition in healthcare. I'm not kidding. We really need competition. This dissolution of these medical groups the time has come. The purpose of forming a medical group and lowering the costs has not achieved the goal of lowering the cost. You know who's going to lower the costs? I can bet you. I'll bet you as a consumer can lower the costs. Not these middlemen, not these billing companies, not the government. Even the government cannot control the costs. They pass more rules and regulations and create blocks on the way, but just let the healthcare professionals, let doctors be doctors and be the best, and let them compete, man. I would like to see the competition in healthcare professionals. You need to bring that spirit back among the healthcare professionals, that putting the consumers in the front line of healthcare will lower the costs. I can bet you. Once you bring the consumers to the front line rather than insurer driven, give the power back to the consumers by lowering your premiums with the deductible health plan, putting money aside into the health savings, having health savings accounts will empower the consumer. Yes, it will empower the consumer, not only the consumer. You will bring back the spirit of healthcare professionals back to the good old days of house calls, telepathy, technology, you name it, folks. Doctors in general are good human beings. You need to tap that. How do you tap it? Bring back the competition. Competition in healthcare is vital. If there is no competition, if the consumers in the front line, once they shop for the healthcare, they look for the competition. They look who's the best doctor in town, best doctor in the country, best renowned doctor in the world. They will go where the competition is. They will go where the prices are reasonable. We need Amazon in healthcare, man. We really need Amazon. Bring back those. Look at Amazon wouldn't exist. Google wouldn't exist without a consumer. Without a consumer, these companies will not survive. So consumers are the only one who can bring back changes in the healthcare. Folks, if you like what I'm saying, please make some comments. Subscribe to this. Foremost organization is a nonprofit organization. Go to dollarcare.org. Google MD Live, Microsoft MD Live, Alexa MD Live, you name it, Siri MD Live.com, or go to foremostorganization.org. Subscribe, share, make some comments, and I would like you to donate for this nonprofit for a good cause to bring the healthcare back to the people. Yes, this is my goal. This is my lifetime goal. I would like to see healthcare hubs serving people who can't afford the healthcare. We should be giving certificate of guaranteed coverage, not this Medi-Cal card. We should be providing the best care irrespective of the economic class. We need this healthcare back to the people. In 1900s, we had the best healthcare, man. But now I see it's scammed by the middlemen, billers. Everybody is scamming the insurance companies. We need to stop it. We need to stop scamming these insurance companies. If I go to the hospital, I need to know what I'm paying for. I need to sign a bill before they bill my insurance company. I just don't understand the representatives in Washington. Why can't they pass a law that consumers have to sign a bill before they submit to the insurance companies. It's simple, folks. It has a power. Consumers have to sign a bill, any bill, before they get paid. Or let consumers collect the money and pay the insurance companies. There has to be a better solution, not scamming this managed care. You lose the choice of a doctor, you lose the choice of competition, you lose choice in everything. Even the pharma needs to be consumer driven. Yes. Folks, make some comments, subscribe to the channel, follow me. I will continue to harp on consumer empowered healthcare, personalized healthcare. Goodbye. Salute.